I'm Renee Garrick, and I am a professor of clinical medicine and a nephrologist here at New York Medical and Westchester Medical Center. I've been at New York Medical since 1985 and have had many roles at the school and at the hospital. The Vice Dean of the School for Westchester Medical Center, where I have served as the Chief Medical Officer for the last 20 years.
Renee Garrick is the total package. She was the second Chief Medical Officer this organization ever had. She had a big picture capacity. She understood what it took to have people in the community understand what the value of the resource in their neighborhood is. And when I say that neighborhood, I mean the entire Hudson Valley. But in addition, Renee has a great heart.
There's nothing like being a physician. You get to know your patients, especially as a kidney specialist. I've taken care of some patients for almost my whole career. So it's extremely rewarding to know that you can help someone be well and go home and be with their kids and their grandchildren. I think as my career developed, the thing I really cherish is being able to do things for broader numbers of patients. So I've been very involved with the state and nationally with improving healthcare and population health. And locally, it's been the joy of being able to be a physician leader here to make sure that we continue to recruit and retain and reward a phenomenal staff of physicians and nurses.
Dr. Garrick was one of the main reasons that I left Harvard Medical School to come to NYMC and WMC. I thought this is a place I could come and find a mentor in Dr. Garrick. She is incredibly wise, and her approach is to lead with heart and to lead with compassion.
Dr. Garrick is my boss, and she's been the best mentor that I've ever had. She always has her finger on the pulse of everything that's going on in the organization.
I think Renee had the capacity to understand why the problem developed first, and then to figure out with colleagues the best solution. And she is able to handle the most serious problems facing fellow faculty, facing students, and of course facing patients with empathy and understanding.
Renee is, as a physician, the ultimate emergency room doctor who's not an emergency room doctor. She never saw a crisis that she didn't want to be in the middle of. And if there was ever a person who wanted to be deeply in the arena of drama and management and clinical care, it's Renee Garrick. She's devoted her life to Westchester Medical Center. She's devoted her life to providing for a community hospital for this community. She exemplifies what the Jackson Spears Award is all about.
I stayed at New York Medical College for 40 years because obviously I love it here. The iterations of NYMC over the years that I've been here and the growth and the development and the expansion of the school, it is an amazing organization, and being able to be part of that and to know that we can help ensure the health care of the population of this region has been extremely rewarding.